So I'm Joe Greene. I'm a board-certified orthopedic surgeon specializing in hip and knee reconstruction. We're going to talk about post-operative pain management. Unfortunately, with orthopedic surgery, when we move muscles around and when we work on the bones, there's just some inherent soreness or pain that happens after surgery that we use a multimodal pain control approach. We try to minimize that first of all with how we do our anesthesia. We typically do spinal anesthesia where our patient's numb from the waist down. We also do a local injection of a multitude of different medicines, all in an effort to kind of numb the area to help pain control. In the knee replacements, we also do a peripheral nerve block called an adductor canal block, which numbs up the nerve on the inside part of the leg just for pain control. Really, we do a great job for the first 24 to 36 hours. Patients really don't have much pain. But after that, those nerve blocks start to kind of wear off and some of the swelling starts to really kick in. When you think about if you stub your big toe or you jam your finger, really the worst swelling after an injury like that occurs about 24 to 36 hours afterwards. It's the same after surgery. And so what we try to do is to minimize that. We give people a host of different medicines for that purpose. Number one is we usually use an opioid. Usually we typically use Oxycodone in our practice. That's a pain medication. And so that's typically taken once every 4 hours. Every now and then, the first couple of days, patients might need to take 2 pills at once in different intervals to kind of help with pain control. We also prescribe Tramadol or Ultram. That's an anti-inflammatory / pain medication that can be taken every 6 hours. That will target both the inflammatory cascade as well as some of the opioid receptors. And so what we're trying to do is target the different pathways of the pain response in the human body to make people as comfortable as possible. We also typically recommend a non-steroidal anti-inflammatory drug, so that can either be meloxicam, Celebrex, ibuprofen, so it depends. If patients are on that before surgery, usually we'll ask them to just start it again, and if they're not, then we might even prescribe one of those for after surgery to help with the inflammation and swelling. We also prescribe typically 2 aspirin a day to prevent the blood clot risk, and sometimes we also prescribe prednisone or oral steroids if they're not diabetic.